So will these new measures be effective in combating the wave of coronavirus France is experiencing? Let's talk to François Balloux. He's the director of the Genetics Institute at the University College London. Thanks for joining us today on the programme, Mr. Balloux. First of all, the French government here really seems like it's trying to incentivise people to get vaccinated. It's appealing to our instincts as social animals, saying you can't really go to a restaurant if you've not been vaccinated, for example. Do you think that strategy is going to work?
I think it will probably work in terms of increasing the uptake of vaccination. Whether it will work in terms of diminishing vaccine hesitancy or possibly fueling it, I think that's another problem. I think there are trade-offs with such strong borderline coercive strategies. Yes, these are it's a pretty strong strategy.
But it is clear, though, isn't it, that in the United Kingdom, where you work, a greater number of people have already been vaccinated against coronavirus, but cases in the UK are surging. So are vaccinations alone enough to combat Delta, which is clearly an aggressive strain of this virus?
So Delta is clearly more transmissible. That is very clear, and the UK is currently experiencing a strong Delta wave, and most European countries will experience very similar situations. Now, vaccination is very effective. It limits transmission dramatically, but even more so, it limits the number of hospitalizations and deaths. So I'm not convinced at this stage we can completely suppress transmission with vaccination alone, but what we can do is bring down hospitalizations and death to very low levels. And obviously, the higher the proportion of the population is vaccinated, in particular the people most at risk or the people who might make others be most at risk, for instance, care workers, then that will obviously lead to much lower morbidity and mortality.
Are you concerned about what's happening in the United Kingdom? From next week, people will no longer have to wear masks in public spaces if they don't want to. That includes in supermarkets, on public transport. Will that, in your view, produce a great surge in the number of cases?
So at the moment, there's still a surge. Case numbers are still going up, but the kind of the epidemic is not accelerating. It tends to be decelerating, despite the fact that case numbers are still going up on a daily basis. The UK is in a fairly unusual situation in the sense that 90% of the adult population has antibodies to the virus. So the vast majority of them due to vaccination, not always 2 doses, not always 2 weeks after the 2 dose, the second dose, which is really when the vaccination becomes most effective. But 90% of the population having antibodies, adult population, is still very, very high. So the UK is in a situation where we can expect actually the epidemic to start slowing down and probably going down. Now, many people feel that the relaxation of the remaining measures might be a gamble. However, in a sense, it might actually not make such of a difference if it's well timed.
Just finally and briefly, if you can, there's been some discussion of booster shots in both in France and in the United Kingdom. This is an additional jab given to people perhaps in the autumn, those who are clinically vulnerable. Is there not an incentive instead to send those vaccines to other parts of the world where people have had almost no herd immunity at all?
It's an interesting ethical problem. I think we have to separate different issues. So each new or most new variants, when they emerge, they have a marginally higher chance to bypass the protection by the vaccine, generally still giving a very, very good protection from hospitalization and death. And clinically vulnerable people often are immunocompromised, and they generally don't react so well to only 2 doses of vaccines. And the third dose has been shown actually to bring them back really to good levels of neutralizing antibodies, so good protection. So I think for clinically vulnerable people, it is very reasonable to consider a third dose. For the general population at this stage, given that a large fraction of the population is not vaccinated, and as you say, there are countries that have extremely low vaccination levels, I think it's more questionable. And I don't think there's any urgency to give a third dose of vaccine to anyone who is not highly clinically vulnerable at this stage.
François Balloux talking to us there. Thank you very much indeed.